Infant Survival and SIDS Alliance. And today we have a special guest, and she is going to be talking, this is Lauren Tandy, and she's going to be talking about the importance of tummy time and safe sleep and how they go hand in hand. And so if you know anything about our foundation and what we do, we teach safe infant sleep classes to parents and families and caregivers and professionals. We train hospitals for the safe sleep certification all throughout the Northwest. So we're really passionate about safe sleep, and I'm excited to have Lauren here. So hi, Lauren.
Hey, Liz. Thanks for inviting me.
You're welcome.
So what we were working on was Liz is going to be screen sharing the presentation from her computer. So when she shares that, you'll want to pin her view to your view. So you can do that by clicking pin at the top so that it's not on speaker view. Otherwise, you'll be seeing me, but not the presentation slides. So I guess it's your choice. But I'm excited to participate in this because back to bed, tummy to play is a very close and important thing to me. I'm a speech language pathologist and I work with early intervention, but more important than that, I have a son who had brachycephaly, eosinophilic esophagitis, really bad reflux. And so I would put him back to bed every night, but also during the day, I had a really hard time getting him to do tummy time because he had all these issues going on. I'm a feeding therapist as well. And so I work with, my caseload it consists of a lot of feeding kiddos who have swallowing difficulties, just like my son had. We ended up having to get him a helmet, and he wore the helmet a little bit to normalize his head shape. And I learned a lot in the process about how to help him with tummy time, how to help him in his physical and speech language development and other areas. I really realized how much tummy time affects our development. And so with all of us going to make a concerted effort to put our babies on their back to bed and to use the appropriate sleep safe guidelines, it's important for us to remember that during the daytime, during the wake times, we also need to make a concerted effort to do some tummy time and work on that development. So do you want to share the screen, Liz? And we'll get started. All right. So that's me, Lauren Tandy. I am a speech language pathologist. And one thing I didn't add to the slides, Liz, was the information about my company. So I am the owner and founder of Tandy Therapy, LLC, as well as Tandy Therapy Box, LLC, where I share resources with speech language pathologists for use with parents and families and their caseload. And so I also have an early intervention telepractice Facebook group where we share a lot of free resources, and this will be shared there as well. I encourage all clinicians to share this with their families. We talk a lot in early intervention about the importance of tummy time. So we'll find out a little bit more about that today for both parents and clinicians. Scroll down. All right, so why should we do tummy time? So recent findings, recent research says that back to bed is the best position because it decreases the incidence of sudden infant death syndrome, otherwise known as SIDS. And because of that, we also put them on their back a lot during the day. And so that cumulative amount of when baby is on their back decreases the amount that they're in the other flexion side, where they are coming out of this position into this position. So back to bed is great for reducing SIDS, but it has to be paired with tummy time during the day and wake hours for appropriate development. So studies have shown that with the back to bed push, there has been a reduced incidence of SIDS, which is great. I had a physical therapist that I work with in early intervention in Washington, Erin Lewis. Thank you, Erin. Give me a lot of research and information. The references are on the last page. If you're a reference and research type person, you can look there. But she shared with me a lot of information from the physical therapist's point of view as well for this presentation. Okay, go ahead and scroll. So how much time should my baby be on their back? This is a common question that I get in therapy. We all get it in therapy. Parents wonder it. I wondered it as a mom. I have 3 children. Now they are 10, 7, and 3. So I'm kind of past that point. But with each baby, I did more and more. And so according to my research, infants between the age of 0 to 6 months are recommended to have 11 to 14 hours of sleep, encompassing bedtime and naps. That's from Erin, thank you. And with infants being placed on their backs for sleep, it equates to hours in an altered natural position of the body, especially during the first 3 months of their lives. So first 3 months. So that's news to some of us. Some parents think they have to wait to start tummy time. So scroll up. So what does this mean? When the baby is on their back more often, it requires opposite positioning. So prone or on the stomach to kind of get out of that flexion, and to reduce positional plagiocephaly or brachycephaly, which are also sometimes called flat head syndrome, and to increase work in those listed areas. So let's talk about plagiocephaly and brachycephaly real quick. Brachycephaly is when the head is symmetrically flat in the back. Brachycephaly is when it is lopsided flat on either one or the other. So it's asymmetrical. And you might see with brachycephaly, bossing of the front fontanelles right here, and then a flat kind of drop off in the back. And then you might see some bumps at the back of the head base. So my physical therapist friends can use better technical terms for that, but my experience with my son having brachycephaly, it also, as a speech language pathologist, there's research on either side of the fence, whether it in itself affects development or not, but it kind of goes along with a lot of other things, including lack of tummy time or increased time on the baby's back. In my son's case, he also had severe reflux, which affected his arching position. Plagiocephaly, you might see bossing on one side and flattening on the other side of the forehead. Same with the back of the head. It just looks asymmetrical. And that's typically when a baby is going to one side or has tight neck muscles or tightness in one side. That can be due to a lot of things, but it can also be extra time on the back in a preferred position. So the areas that tummy time is going to work is head and neck control, core strength, so getting that core nice and strong, back strength. When you're going like this and trying to pull your head up, you're going to increase the baby's back strength. Movement control, so they're going to be pushing up with their forearms, extension of body to counter and balance natural flexion. All right. So what does tummy time support? So we talked about the physical strengthening, but what areas of development does that help? So it helps with a lot, and I listed some here, but this is not the end of it. This is a short list. Feeding and swallowing, breathing and speech. So they're exercising their diaphragm here, their accessory muscles for breathing, their head and neck support muscles, their back muscles. All of that is kind of like a cage around our breathing mechanisms, which is a support for speech as well. So rolling and movement, kiddos that spend a lot of time on their back might roll over at a later time. Supported seated position. So if you're not getting that good core strength, control, and strengthening, you're going to see a baby who has a hard time sitting up. Before I knew about core strength and before I started yoga, I spent a lot of time in this kind of position. That's what you might see with a baby too. You might see a lot of this because they haven't strengthened the core to sit up either in a supported seated position with something around them or with you holding their trunk, or by themselves. And sitting up by themselves independently is a base foundational skill in order to start eating solids. And it also helps safety with swallowing. Exploration of environment, which leads to language development, caregiver interaction, and meeting needs. So if they are stagnant, not sitting up, not rolling around, not getting to the crawling position, they're going to have limited interaction. Reaching and grasping objects, that core strength and trunk control is a center and base to reach out and separate their arm and to grab things. Handwriting and sitting in chairs at school, that's a later developing skill that's affected by the whole motor movement. And then lots more. So we've talked about this a little bit already. What if my baby lacks tummy time? So we might see some things like the things that we talked about, but basically a delay in acquisition of typical motor milestones. The potential for misshapen head, the flat head syndrome, plagiocephaly, brachycephaly, associated torticollis, which is asymmetry of head and neck position, which may cause the plagiocephaly. And then research and guidelines substantiate parents' struggle to meet the recommendations for infants playing and engaging in tummy time. So it is important, and let's move up. Again, possible delays due to limited tummy time. Rolling over, sitting up, supported seated position, transitioning to solids, like I mentioned, safely swallowing liquids, prolonged reflux in some situations. I experienced this with my third child, my daughter, who was born with a low birth weight. And she, no matter how hard we tried, and me being a feeding therapist, she continued to vomit after every feed. And we literally had to hold her upright to keep everything down. We had an extended stay in the hospital because of it. So with her, and this is my own case study as a speech language pathologist, early interventionist, and feeding therapist, but I put her on the ground from birth on a blanket, on my stomach. I'll talk about modified positioning later, but I had her on the ground from birth when we got home. And even though she was spitting up all of the time, we were keeping her weight up. I would try to pick the optimal times for tummy time where I would avoid, keep her upright for 30 minutes after the feed, but then I'd lay her down on her tummy and let her play. And so it looks different as they get older, what tummy time should look like. But that in itself got rid of the reflux so much faster than I would have seen with my second child who had EOE and was on his back all the time and had that delay in motor milestone development. Okay, so effectively sucking and swallowing from a bottle or a breast, reaching and grasping objects, visual tracking, getting that head and neck control, social interaction with caregivers. So again, it limits where they are able to go, an ability to clear their airway from reflux or face from filler items. So this has to do with SIDS. If they are refluxing or spitting up at night, they need to be able to A, get themselves away from it, and B, swallow it back down safely, swallow it back down the right way instead of aspirating. So if baby has poor, it's kind of mushy, low tone, and they're spitting up, this increases the likelihood of SIDS at night if they can't get themselves away from it or re-swallow, as well as if there are any extra things in the crib, which there shouldn't be. But we all have families that don't follow all of our recommendations. That core strength and that ability to move their head and neck or push up and roll over can save them sometimes. Delayed crawling, delayed walking, running, and climbing, that goes along with the motor milestone kind of being pushed out. So in the area of speech and language development, so a delayed access and learning in surrounding play environment. Babies learn speech and language through caregiver interaction and developing relationships. And if they are not able to move to you to get your attention or learn, if I reach over and do this, or if I pull on this, mommy's going to come pay attention to me, or if I shake the rattle. So if baby is not getting around their environment, if they're stuck in a container like a saucer or a jumper or a swing, and not on the ground moving around and reaching out and looking at different toys and making noises that gets mom's attention, they're going to have limited interaction with mom. They're in a container that keeps them satisfied, but not engaging with their environment. So learning of how things work and engagement with caregiver. Joint attention is how babies and kids learn language and speech. Joint attention is a baby looking at an object, looking at their caregiver, and looking back at the object. And that is getting the caregiver's attention to say, hey, are you looking at what I'm looking at? Look at this. I see it. Do you see it? So that's some pragmatic skills, social interaction. Lung development for vocalization, experimentation, and sound play. So that again is the core development, working that diaphragm, getting those muscles working, and starting to make sounds, starting to hear experimentations with cooing, and then eventually neck and tongue and palate control and experimentation with consonant sounds. Imitation using gross or fine motor movements, so imitating mom in the supported seated position, imitation of speech sounds, imitation of words eventually. So I touched on this before with my third baby. Start tummy time at birth. This takes advantage of so much time that we don't even think about after we come home from the hospital. It's kind of not high on our priority list, depending on what's going on for you. This can be, I have a list of exceptions when it may not be appropriate to start right away, or you may need to follow your doctor's guidelines for when to start tummy time, such as maybe there is severe reflux, or maybe there's a G-tube going in and they need to heal, or cardiac surgery. So we'll touch on some of those later. But start at birth. For typically developing children, it can be done, and I'm going to show you how a little bit later. All right, go down. So what does it look like at birth? Laying the baby on your chest. Okay, so I'm going to introduce you to my doll. I really feel like I should name her, but I haven't. This is a doll that is from a cartoon, and I don't remember what cartoon, but I like her because look at this. Her elbows move, her wrist moves, her knees and hips move. So I can put her in the best positions. So modified to lay the baby on your chest. Obviously, her head doesn't move, but babies typically may go like this to look at you and get that eye gaze. Can you hear me all right, Liz? Okay, I'll move my microphone a little closer. So that's one modified position, is laying on your chest. Another modified position, I'm gonna see if I can move my desk down so you can see me, is baby on your lap, and her head doesn't go up as much, but if I lay her on my lap, I can pat her back. This is a good position for soothing kids too. I can rub her back. I could put something on the floor for her to pay attention to, or one of my children could get on the floor for her to play with or play peekaboo with. Laying baby on a flat surface with a blanket. All right, so as a baby, this is possible, but with complete supervision. So here's my blanket. I'm gonna lay baby down, and typically baby will go like this. Baby will lay her head sideways. She's not pushing up, but so you don't have to look at my trash. Baby's not pushing up yet. She's a newborn. She doesn't have that core strength and support, but she is clearing her airway. So she's looking to the side, and she might eventually start going side to side where she moves her head to the other side. So she's just getting used to that tummy time positioning so that later she's not going to cry when you put her down. She's going to be okay with it. It's a familiar position, and it's comfortable for her, and she knows that everything's going to be okay. You can get down and talk to her while she's down there. You can play with toys to get her attention. But mostly at that age, just your voice is soothing for them. All right, lay baby on one forearm while holding the other. So I'm not sure which one that was. So lay baby on one forearm while holding the other. So you can do sideline position. Just getting baby used to different positions other than on their back. So we talked about brachycephaly and plagiocephaly being an irregular head shape, and that has to do with a lot of different things, but a way that you can avoid it is avoiding container devices. Things like overhead play mobile for a baby laid on their back. So these are appropriate for limited times. They're not appropriate for all day play. Leaving baby in the car seat is a big no-no. This is also a risk for suffocation. It can kink the airway, and especially for a baby who doesn't get tummy time, that neck is at higher risk to be crunched and falling down rather than a baby that has good trunk and neck support. So please don't leave your baby in the car seat when you get home. Laying baby in a bouncer for long periods of time. So yes, there's appropriate times for this when we need to cut dinner or things like that, but leaving baby there for an extended period or all day or having that be your go-to is going to create possibly a flat head in the back. So using the baby's swing all day, using a reclined rocking device to keep baby pacified. There have been some recalls on some of these things, and Liz keeps close track of that with her Safe Sleep and Inland Northwest SIDS Foundation. So refer there for information on recalls. Alternatives to container devices. So there's lots of fun things you can do. We just need to bring some awareness to them because we are advertised to these products that put our babies in place. And sometimes as a busy mom, that can seem like even a lifesaver, but it may create problems for you down the road. So alternatives could be sit and play activities with supported seated position on the floor. So I had a client recently who got her son, who has reflex and back arching, a little play area that he could sit in. So it gave him back support. And then it had toys around him, and he sat on the floor. He sat on the floor so he could move his legs around, and he could move to the side or up if he wanted to. He could also pull himself up. It was not something where you put your legs in to sit in. So tummy time, more ideas coming. Modified tummy time, more ideas coming. And then body wearing. So for those reflux kids who, if you do lay them down, they're going to spit up. And if you need another option other than, you know, alternating between a swing or a bouncer, you can also have the option of wearing the baby. And there are appropriate ways to do that as well. So what if my baby hates tummy time? I've seen this so many times where parents give up on tummy time because baby cries. And the trick to tummy time is keeping baby engaged. So we're going to talk about some things that will help you do that, but make it a game. Tummy time is not just laying baby down and being done with it. That's not tummy time. It can be if the baby is older and starting to, you know, reach out and roll around and search for things. But when you're starting out and baby's not a fan, that's not tummy time. So we're going to talk about making it a game. So some games to target tummy time are airplane. This is my sister Marielle's favorite thing to do with my kids, but you can also do it with babies by putting them on your feet and lifting them up in the air and holding them in a supported position. This is better for bigger babies, but the baby lift. So here's the baby lift. Laying on your back, getting a good support, and looking at baby like this. I'm looking at baby like this, and it is good for caregiver engagement, eye contact, eye gaze. All right, reaching for toys. So putting baby down, and then toys in front, toys to the side. And I would recommend doing each side. Keep it bilateral, keep equal time on either side. And then the chest support boost. We saw a picture of that earlier with a boppy pillow or rolled blanket underneath the chest for support. You can use a plastic mirror in front of them so they're seeing their reflection. And then you'll see a yoga ball in this picture that can actually be used for rolling the baby on her tummy back and forth, back and forth. It's a really fun one. And Liz, I have my daughter out here knocking on the window. Do you want to talk a little bit about the container recalls or containers that you have information on?
Yeah. So some products that have been recalled that are really important to watch for in your family's homes are going to be incline sleepers. So the Rock and Play put out by Fisher Price, anything that puts that baby's head, you know, for incline sleep really is going to be recalled. And so what happens, like Lauren talked about, is chin to chest, pinching off baby's airways. And so we want to definitely be aware of those items in the home. And then I'm talking to families about, you know, sleeping babies flat on their backs for every sleep. So what is safe is going to be a crib, a bassinet, or a portable crib. which are the pack and place. And so those are really safe and help, for sleep for babies. And so some other recalled products that have been out, or some other products that you might want to be aware of. Let's see, the DocaTot. There was actually a warning out about one of those for sleeping. So it's like a pod that goes in the adult bed. And so then it has like a barrier around the baby. And so the concern there is the baby rolling into the side of the DocaTot. And then of course the soft surface of the adult bed. So sometimes they're called pods or nests, or the DocaTot. So just being aware of those items in the homes of the families that you serve, and talking to them about safe sleep and the dangers of those products. So
Thank you.
you're welcome.
All right. So the other question that I get all the time is, how much time should I aim for? And to start, for a baby, it should be substantial time in duration. So if there is a baby who is not crying when you lay them down immediately, 15 to 30 minutes might be possible to start. But then if that's not possible, and if baby cries, you just meet them where they are, and you work up from there. The important thing is that you're doing it multiple times a day. So this says 15 to 30 minutes, 3 to 5 times a day. I've heard Laura Mize recommend up to 45 minutes per day combined time. I have heard other recommendations. There is no set recommendation per age, per research, but the more the better. And the more they do, the stronger they get, and the closer they get to rolling, sitting up, and crawling. And then they move out of tummy time naturally. So the more the better, and multiple times per day. Oh, and one thing on that slide that I did want to add is you add all the time up. So adding, if I did 20 minutes in the morning and then 4 more times throughout the day, adding that up for total minutes, not each time minutes. Okay. And then spread it out. It's better when it's integrated into your day and your routines. If you are playing with baby, putting them on your stomach to look and talk to, that's great. For birth to 3, you can build up to 30 to 60 minutes throughout the day with an average goal of 45 minutes for the day. And then you can use 5-minute increments. So smaller increments for baby to 3 month, building on that as they get older. All right, so doing tummy time gives you an opportunity to get involved with your baby. You see the airplane here, and this can also be with her hands on the trunk for a baby lift. So it gets you engaged with your child, and you will be pleasantly surprised, or your families might be pleasantly surprised, that with this increased fun tummy time, not like the crying tummy time that sometimes we think about, with the fun tummy time and you getting down on the ground with your baby and using toys to interact and getting their attention and eye gaze, they're really going to develop that bond with their caregiver. They're going to develop in so many areas, including physical areas of development, both fine motor and gross motor that we've talked about, including occupational, that grasp and reaching for things, and then also speech and language development. What do I do when my baby cries? So you put them on the ground, they cry immediately. Most parents hate to hear their baby cry. It makes us cringe inside. It hurts me sometimes to hear a baby cry. But you have to realize that it doesn't always mean that they're in trouble. It means that they may want you, or they're above their skill level or capability. So back it up a notch, see if you can modify it to the point that they're not crying. Get creative, modify the position, get down and engage the child, use shorter increments, use toys. So experiment with it and don't just think, oh, my baby cried, I can't do this. My baby can't do this. Experiment, get creative. So here's the exceptions that I was talking about before. Severe reflux, where baby can't lie flat. Feeding tubes, where there's surgery that needs to happen and some healing time afterwards. Same with cardiac babies. Kids who need supplemental oxygen, you really need to watch their stats with that. So tummy time, how I'm presenting it, is not appropriate for all kids across the board. Every situation needs to be looked at as an individual situation, and the time, so length of tummy time, positioning of tummy time, and goal time for the whole day needs to be made on an individual basis per the kid's need. If there are any impairments that are involved or any disorders. So this is not across the board. Refer to your pediatrician or your specialist or your clinician to make specific or individual recommendations. All right, final thoughts. Get on the floor and play with your baby. Play is how our children learn throughout infancy to adolescence. This is no different. You as a caregiver have a bond with your baby that transcends difficulty. So if your demeanor and action says that tummy time is okay, then baby will follow your lead. This can be difficult sometimes, but keep in mind that if you get down and play with your baby, they're much more likely to enjoy the interaction on tummy time than if they are just laid there to fend for themselves. They're not at the level yet that they can self-soothe. They need you. They need you to help them. And here are our references for research. And that is the end of my presentation. So we can have any questions if you'd like, Liz.
Yeah, let me pull up our Q&A, or it doesn't look like we have any questions. Let me pull up chat here. Does anybody have any final questions or thoughts, or did you learn something? Any feedback is great. Maybe some ideas for Lauren for for her Facebook group that you'd like to see happen there. Any questions about safe sleep? We're happy to answer those for you. Let's see. Okay, well, I'll leave that open while I just kind of share with you. I'm going to mail everyone who registered in finished class this cute little board book. It's called Sleep Baby Safe and Snug, and it's a great tummy time tool also. And let's see what else is in here. Super cute. And it's got a great little story. And then on the back are the safe sleep tips. So I'm going to mail you each one of those. Make sure you message me. Oh, thanks, Christy. She said, enjoyed your Zoom. Thank you for the tummy time information.
Thanks, Christy. And Mindy also asked about resources.
Oh.
So Liz does have resources. Go ahead.
Yep. So our website, safestartnw.org, has a ton of short little video clips about safe sleep. And actually car seat safety too. I keep forgetting we added it. We have a giant car seat safety program. So there's a ton of information on our website. It's under video resource tab. And I'll send everybody an email also with some resources linked in it. Lauren and I are going to work on some shorter video clips for families to do, like, how we talked about different games with tummy time, or what am I going to do if my baby cries during tummy time? And so we're going to work on some short little clips that you can share with your families. We do teach a Safe Sleep 101 class, and if your family comes and attends on Zoom, we're mailing out Halo sleep sacks to the families that attend. So please, we're happy to do that for you. So
Yeah, and so myself working as an early interventionist here in the Northwest, Liz has been gracious enough to provide sleep sacks for some of my patients who couldn't otherwise afford them. So she is good on that promise, and that's a great resource for the Northwest area.
And Courtney, thank you. I love the demonstration of different positions to try for tummy time and the solid information to provide parents about why tummy time is so important. Yes.
Yeah, so I will be working on a few more resources for that I'll put up on my resource page, which you guys might already have, but excuse my finger, I heard it gardening this morning. It's hard to type, but I will type it in here slowly. And I will be eventually adding to it. And like Liz said, we're going to work on some shorter video clips. So I will upload resources there when I have them. And then what's your web page, Liz?
I just put it up, safestartnw.org.
There you go.
Yep.
All right. Thank you, everyone.
Thanks, everybody. Have a good Memorial weekend.
Yes.
Time.
Bye.
Bye, everyone. Thank you.